So background of this study is this is, as all of us know, as the uncommon EGFR alterations have shown poor outcomes in non-small cell lung cancer as compared to EGFR mutated non-small cell lung cancer. And there are 2-3 uncommon mutations which are common, that is S7681 substitution in exon 20 and the L861Q mutation in exon 21, G719X. These are the most common uncommon EGFR mutations, and which constitute about 1 to 2% of total EGFR mutated cases. Globally, the prevalence of this uncommon EGFR mutation is similar to other molecular drivers such as BRAF mutation, ROS1 and ALK rearrangement. So aim of this study is to investigate the efficacy and safety of PD-1 and PD-L1 blockade along with anti-angiogenesis inhibitors treatments in non-small cell lung cancer with uncommon EGFR mutations. So the study is phase 2 single arm study, and this is prospective study which is done in China. And patient received Sintilimab, that is anti-PD-1 inhibitors, along with Anlotinib, which is multi-target anti-angiogenesis inhibitors. And the primary endpoint was objective response rate based on RECIST 1.1 criteria. And the secondary goals was progressive free survival, overall survival, and disease control rate based on RECIST 1.1. So the inclusion criteria, as you can see, the ECOG performance score 0 or 1 with genetic testing confirmed uncommon mutation, that EGFR G719X, L861Q, S7681, and 20 insertion. And prior treatment should have at least 2 regimen with platinum-containing systemic chemotherapy and EGFR TKI treatment. They have excluded all other histology like small cell carcinoma, neuroendocrine, and sarcoma components with known EGFR sensitive mutations. And if a patient has a history of treatment with anti-PD-1 or PD-1 or anti-PD-L1 inhibitors, they have excluded. And they have also excluded the tumor which have a high tendency of bleeding, and they are more if tumors is more averting to the major vessels. So total 21 patients were enrolled in this study, and data cutoff time was January 11, 2022. Median follow-up was 15.2 months. Among enrolled patients, EGFR exon 20 insertion were 12 cases, and the rest 9 cases were all other mutations. So coming to results, the patients harboring uncommon EGFR mutations have a median progression-free survival of 6.7 months. With 6 months, PFS rate was 52.4%, and the objective response rate was 36.8%, and disease control rate is 84.2%. And patients carrying EGFR exon 20 insertion showed similar overall response rate, disease control rate, and PFS with other mutation patterns. So total DCR with 90.9% as per this study. Coming to toxicity, 4.8% of the patient had hypertension, 4.8% of total patient had immune-related pneumonitis, and 9.5% had hand-foot syndromes. So the use of Sintilimab and Anlotinib did not result in increased safety patterns. They did not found a very high toxicity. So coming to conclusion, they have concluded that combination of Sintilimab along with Anlotinib demonstrated durable efficacy and good tolerability in non-small cell lung cancer patients with very uncommon EGFR mutations. But further investigation has to be warranted to confirm this new chemotherapy strategy. Thank you.